Hi, I'm Emily Kibler, and today I will be reviewing the pelvis on an extremely anatomically incorrect skeleton that, yes, I may have broken in half. Okay, for the osteology of the pelvis, there are three main bones. There's the ilium, which is kind of this top part. There's the ischium, which is more posterior. It's this back here. And then the pubis, which is this in here. One thing to note about this is that these here, they don't exist. I think there's something with this anatomically incorrect skeleton to keep the screws in place, but just try to ignore those. Yeah. So these three bones, or sections of the bone, connect in this fossa called the acetabulum. This is where the femur articulates with the pelvis and creates that ball and socket joint. It's the socket of the ball and socket joint. And so the two ilium connect with the sacrum in the middle, and then at the end of it is the coccyx. Now all of these pieces, all of the pelvis and the sacrum and the coccyx are all important for attachment sites for muscles, ligaments, and for places where blood vessels and nerves can run through. Now, entire videos can and have been made on all of the individual features of these bones, like the tuberosities and the crests and all of that. So I'm not going to go into too much detail about that, but I'm sure there are other videos you can look at. Okay, so I am going to start with the ligaments, but before I do that, I want to say that I added this right here, which is the pubis symphysis, which is a fibrocartilage ring attaching the two pubis bones. I have labeled the two major ligaments of the lateral pelvic wall in yarn. The most anterior and smallest of the two is called the sacrospinous ligament, and it is shaped like a triangle with the wide end attaching to the sacrum and down to the coccyx, and the smaller end attaching to the ischial spine. The other is larger and more posterior, and it is this one right here. It is also shaped like a triangle with the wide end attaching from the coccyx, the sacrum, and even up to the posterior superior iliac spine, while the other end is attached to the ischial tuberosity. These two ligaments are very important because they create the sciatic foramen where nerves and blood vessels travel through in the hip. So above the sacrospinous ligament is the greater sciatic foramen. This is it right here. And then between these two ligaments at the bottom, if this incorrect thing wasn't here, you'd be able to see it, is the lesser sciatic foramen. Another important ligament in this area is this one right here. It is called the inguinal ligament, and it is from the pubis to the anterior superior iliac spine. It is an important landmark for muscles, nerves, and blood vessels. Now that we have the major landmarks in place with the ligaments, we can talk about the nerves. One of the major plexuses is called the lumbar plexus, which arises from the different levels of the lumbar vertebrae and generally comes down in this area. So there are some that come here and some that come down. I'll go into a little bit more depth about the important ones for the rest of the lower extremity, but for now that's what you need to know. The other one comes from the sacral region, and those are called the sacral plexus. And so this really goes more towards this area here, and then of course down the leg. An important nerve of the lower extremity is called the femoral nerve. This comes from the lumbar plexus up here and goes under the inguinal ligament. Now, normally when things travel beneath the inguinal ligament, they change names. This is one of the few things that doesn't. Another is called the sciatic nerve. Now, this is a very big nerve, which I've tried to show with the pipe cleaners. And it comes from where the lumbar plexus and the sacral plexus connect, which is called the lumbosacral trunk. This will come through the greater sciatic foramen, which we talked about earlier, and travel posteriorly down the leg. There are many other nerves in this area, but since this is just supposed to be an overview, I'm only going to focus on these two nerves. The blood supply for the lower extremity comes from the aorta, which is this area here, and then splits into the common iliac arteries, and then creates further branches into the external and internal iliac arteries. The internal iliac arteries have a lot of small branches that supply the posterior and general pelvic cavity system. The external iliac artery goes under the inguinal ligament and changes name to become the femoral artery. Now this goes on to supply everything from there on down, the thigh, the leg, and the foot. The venous supply is very similar. It takes deoxygenated blood back up, with this being the inferior vena cava. Okay, so this has been a general overview of the pelvic region with the blood supply, nerves, ligaments, and major bone areas. I'm not going to do the muscles because, like all of the features of the bones, it needs its own video. But I want to return to the idea of how this skeleton is not anatomically correct, because I was going to do the knee for this video, but I discovered that in this skeleton, one, it doesn't have a patella, but that can be managed with clay. It has the tibia on the wrong side of the fibula. So there's a tidbit about this skeleton that makes no sense.